living with congestive heart failure. Sorry for the delay because I was just treating too many patients in the office today with congestive heart failure. I think congestive heart failure, unfortunately, is becoming one of the major causes of morbidity and mortality, and the team has put together a fantastic talk. Things have changed in the era of COVID. Let's see what we learned.
So hi, everyone. Thank you so much for joining us today for our webinar. Now, I know many of us are probably really tired of hearing about COVID-19, but now that we've lived with this virus for what's over 2 years now, we found that it's important to outline what life with heart failure may look like in a world that will have COVID-19 for the unforeseeable future, or coronavirus spreading for the unforeseeable future. So today we'll be talking about some statistics associated with COVID-19 and heart failure, its effect on people with heart failure and on healthy individuals, and the importance of vaccination.
So to begin, let's take a look at two definitions for terms that we'll be using throughout the webinar today. The first one is congestive heart failure, which is written as CHF. This is a condition where the heart does not effectively pump blood. Common symptoms of this include shortness of breath, chest pain, and peripheral swelling. The second term will be cardiovascular disease, which is shortened as CVD. This is a general term for all conditions affecting the heart or blood vessels, and this can include coronary heart disease, stroke, peripheral artery disease, and aortic disease.
So if we just pause for a second, if we go back, so, cardiovascular disease, blocked arteries, has been around for a long time. It in some world, it's the leading cause of death. In other words, it's cancer. So we made great inroads how to treat coronary artery disease over the last 20 years or so. And I'm pleased in Canada, we can actually prevent a lot of heart disease. And so that's important to know that. Now, one of the problems is because we're living longer and older, we're developing congestive heart failure. As you point out, is that the heart's not effectively giving adequate blood supply to people. Or can do that at a higher pressure. So sometimes the heart can be pumping at a higher pressure. So we have multiple forms of congestive heart failure right now. And we've done a series of videos. We'll highlight a few things today. So I want people to realize that you can have a good, strong heart, but you can still be in congestive heart failure. And that's because the heart's stiffened, it's scarred down, it's thickened. You're working at a higher pressure because of weight, blood pressure, it loses elasticity. You can also damage your heart through cardiovascular disease, as you point out, having a heart attack. So these are all important considerations. So let's learn more.
Yes, of course. Moving on with stats. This is our first piece of stats that we like to present, and this one shows that the cause of death in the United States for the past 6 years. And what we can observe from this table is that the total cause of death, the total cases of death has been increasing, and heart disease, unfortunately, remains to be the primary culprit for taking people's lives away, amongst other diseases. And if we take a closer look, we do see that from 2019 to 2020, there's a huge jump in deaths caused by heart disease compared to other years. So next slide, please.
And these are American data. So actually, if you backtrack a little bit over here, this is American data, and Canadian data will be, not dramatically different. We're 10 times the smaller than the population of the state, so you can just divide by 10 if you want. There are some differences. But if you actually look on your far right, you can see in 2020, there was a new disease that unfortunately killed about 350,000 people in the United States. And unfortunately, COVID has killed well over 1 million people in the United States. And the United States has been a population that, of all the Western worlds, has one of the highest incidence, if not the highest incidence of mortality from cardiovascular disease. You've heard this many times. I'm going to say this again. One of the reasons why we don't die as much as the United States is that we've been better vaccinated in the United States. Now, I'm not sure if anybody can circle that COVID-19 340,000 here, and if you look at the bottom over here, influenza and pneumonia at around 53,000. We used to talk about influenza and pneumonia being major killers. They are major killers. And what happened in Canada when the first year of COVID, influenza went away. one, we were isolated and it was overwhelmed by COVID. So these are respiratory diseases and respiratory isolation. You can see a mask around my face right now. And you know, unfortunately, in Canada right now, we're in the 7th wave of COVID. And the good news is COVID is not as a stronger killer as before for multiple reasons, but it does cause a lot of problems. So you can see how things have changed. You can see that, you know, we have a lot of issues in Canada. Cancer and heart disease battle for 1 and 2. Right now in Canada, cancer has a higher mortality compared to cardiovascular disease. In the States, heart disease is still a slightly bigger killer, but these are huge numbers, and there's things that you can make a difference. The good news, what makes a difference from heart disease usually makes a difference from cancer as well. So some of the same risk factors. So being overweight, what you eat impacts heart disease and also cancer as well. So it's always good to look at these numbers here. So important that you can see that suicides are, you know, is a major problem as well. And you can see that we have a lot of things to think about. And you can see Alzheimer's disease, as you know, if it's said if you're an older individual, is that if you don't have Alzheimer's disease, you're looking after somebody who has Alzheimer's disease. And guess what? The things that the best impact on Alzheimer's disease is to walk, keep moving, and keeping thin, keep modifying your risk factors as well. So for instance, if you had a stroke, you're about 7 times more likely to develop Alzheimer's disease. So lots we can learn of. Thank you for sharing that data. Tell us more.
Yeah, of course. So I was just going to point out that from 2019 to 2020, we did observe how there's a drastic increase in cases of deaths caused by CHF and heart diseases. And unfortunately, this increase has been 4.8 in a past year or so, whereas in other years, this increase is more so only at like 1 or 2%. And we figured out 3 reasons for this to happen. And they are patient hospitalization, changes in hospital staffing, and the presence of comorbidity. And as you might expect, all 3 factors are impacted by COVID-19. So since the presence of COVID-19, patients have avoided going to hospitals, unfortunately. And a survey that's been conducted in the United States found that 40% of Americans do not feel safe to attend doctor's appointments, and 30% of Americans have actually paused their routine checkups with doctors since 2020. This trend is also observed on the other side of the world in Norway, as the graph in the bottom shows. The hospitalization cases for CVD in 2019, which is shown in blue, and the hospitalization cases for CVD in 2020, which is shown in orange, have been plotted on the graph. And along with that, we also see the COVID-19 hospitalization cases, which is shown in the gray triangle at the bottom. And what we can see from this graph is that before the first COVID case has appeared, the trend from 2019 to 2020 is nearly identical. However, after the first case of COVID-19 appeared in Norway, and after Norway's lockdown procedure has begun, this number has drastically dropped. So those examples are essentially showing how COVID has impacted patients' willingness to be hospitalized or even go near hospital settings. And this is mostly due to fear of catching COVID-19. The second factor that we've outlined is changes in hospital staffing. And what we found was that in Canada alone, there's a 30 to 66% reduction in hospital staff for different departments. And this is mostly due to how hospital staff is needed to combat COVID-19 because it's quite big of an issue. And one of these departments that's been reduced would be CVD. And as a result, when the first COVID-19 wave hit, there was a severe reduction in hospital admission of patients, down to about 35%. That's been shown on the graph on the right. And as we can see, whenever there's a COVID wave, the percentage would drop in the following week or months. And this is due to both how staff has been pulled away to do other jobs, and patients are not willing to go to the hospital. In addition to patients unwilling to go to hospital, there's another interesting trend that we've observed while researching. And it's been noted that in 2019 and 2020, racial minorities has experienced a 20% increase in deaths caused by CHF. And we found that there might be 4 reasons that cause this trend. The first is discharge rate for racial minorities is faster than that of white, and the post-acute care is often not as focused as it should have been for racial minorities. The second reason is socioeconomic status. And although this has been an ongoing topic for several years, it is still a valid topic and should still gain a bit of attention. Racial minorities are exposed to less opportunities and they have to thrive through different challenges. And in severe cases, such as those in poverty or in extreme isolation, they are not getting the healthcare benefits that they should be. And when they have signs or symptoms of the disease, they're likely not going to get the proper attention and treatment either. This ties with saying the third and the fourth point, where patients in those conditions are at a higher rate of developing diseases such as CVD or catching COVID. And if they're still not being treated, then unfortunately, this is going to reflect in a death rate. So the third kind of factor to the 4.8% increase that we've briefly touched on was the presence of multiple diseases in a patient or comorbidity. And this is definitely an important topic as comorbidity complicates situations. And this can result in a higher death rate. So COVID alone has a death rate of 2.3%. However, when it's combined with other diseases, this value has increased. And for example, if a patient has CVD and caught COVID-19, then their chances of this situation being fatal is about 10.5%. And soon in this webinar, we'll go over why this might be happening.
So actually, if you just backtrack, it's kind of interesting. So is that the mortality from COVID has changed. One, we learned how to treat it. We now have vaccination, and also the disease has mutated. And it's changed, it's going to change again. But you can see that when initially people came to the hospital, they came to the hospital with COVID. Now when people are coming to hospital, they're coming to hospital with COVID and something else, let's say cardiovascular disease, diabetes, high blood pressure, underlying lung disease, smoking, pneumonias, infections, renal insufficiency, cancer. These all unfortunately magnify risk. And one of the things is you mentioned is that just having high blood pressure, look at this, you go from a 2%, this is from the initial sets of data. So things have evolved, but the ratios will stay the same. So you started off with a mortality of 2%. And if you just have high blood pressure, a little bit of high blood pressure, you can see how mortality goes up to 6%, threefold increase. The rationale for this is that COVID actually enters cells through something called the AT1 receptor, which you're going to show on them. And these receptors are lining all your major blood vessels. And so this means that when COVID invades the cell, it destroys the cell. It takes over the cell, it kills cells. So it kills, cells that line your blood vessels. It kills cells in your brain, it kills cells in your pancreas, it kills cells in your heart. And basically, the best defense about COVID is not getting in the first place. So go live in your bubble somewhere and don't have any COVID. But once you go to the world, unfortunately, COVID's everywhere. And so the way I think about it is the first thing, I'm still going to be smart about social distancing, but we also know that we're in the summertime right now in Canada, and COVID is 35 times less likely to spread outside compared to inside. So do as much as you can outside. And basically, the further away you are from someone is 6 feet further distance. More is better, but certainly that 6 foot rule is as a reasonable starting. It goes by droplets, and these droplets can go greater than 6 feet. And you can be, as you know, asymptomatic and still spread the disease. And so what happens by being vaccinated, you expose your body to a better defense mechanism. Now, your immune system is quite smart. It has different defense mechanisms. It will recognize previous infection and mount a defense mechanism. And you have an immediate effect related to something called interferon. This is a non-specific response to infections in general. So depending on how good your interferon system will be, that will give round one a defense. But by being exposed to the virus in the past or being vaccinated, your body can mount a bigger immune system, quicker, better defense mechanism. So to me, if I can't avoid the virus, the next thing I want to do is, proper hand washing techniques and wearing appropriate masks. These masks that we have in front of us, 2 or 3 ply surgical masks, I'm glad that people aren't really wearing cloth masks anymore because they're not all that effective. These masks are somewhat effective. Obviously, an N95 equivalent is even better, but needs to be properly fitted to make that effective. And you can't rub your face and your eyes and things of that nature as well. So, and the vaccine has been such a powerful effect. And people say, well, why do we have COVID? Well, we'll talk about that in some ways, but what turns out, our generation of vaccines right now don't prevent you from getting COVID, they decrease the severity by a lot. And so there's a big difference between properly vaccinated. So I'm getting vaccinated right now every 6 months, and that will change as more information becomes available. So, but you can just see, you can add the extra problems to your heart. And one of the things is that if you're prone to diabetes, guess what? COVID is going to accelerate diabetes, and it damages your pancreatic cells. It shrinks your brain, makes you more like, we saw mortality from Alzheimer's disease. Well, we know from the British Biobank that people who got COVID, their brain shrinks. And if your brain shrinks, you're more likely to get Alzheimer's disease. So you can see how there's an impact on all sorts of parts of your body. I remember that movie called Concussion. I guess growing up, I played different sports. I didn't worry about concussions, but I probably accelerated dementia by banging my head too much as time goes on. So I'm going to try to bang my body less with COVID and be protected. So keep telling us more. Sorry to be long-winded, but this is still very important. Don't forget this, that there's lots you can do to keep yourself healthy. Yes, you can avoid COVID. Yes, you may get COVID. Yes, you won't die from COVID necessarily, but it will make you sicker and you will pay a price down the road.
Okay, so now that we've taken a look at some important statistics, we can kind of move on now to address the question, why are heart failure patients more prone to severe illness from COVID-19? So when we examine how the COVID-19 virus enters our body, we know that it's usually through inhalation. So it enters through our mouth first, and then from there it can kind of pass into our bloodstream and travel down to our heart through some blood vessels in our neck area. And then from the heart, the blood can kind of continue being pumped along with the virus, and it can eventually enter like smaller capillaries in the lungs as well as other major organs. And when it goes there, as you mentioned, it can bind to its receptor AT1 or ACE2, and those receptors are usually on endothelial cells for blood vessels and also cardiomyocytes or cardiac muscle cells. So when it binds, it can kind of be endocytosed inside, and that's when like the membrane kind of buds inside, it's kind of swallowed up. And then the virus can release some viral RNA, and during that whole process, it kind of replicates itself and takes control of that host cell. And when that's happening, this can really create a lot of stress inside that host cell that it's taking over. And over time, it can lose its ability to kind of keep balance and homeostasis, and can also eventually lead to apoptosis or cell death.
So it's actually important. So you say it goes through endothelial cells. That's all the lining of all your blood vessels. It enters, it takes over the machinery. It's called an RNA virus. So what it does, it takes over your machinery. It cannot survive without destroying your machinery. It kills your cells and takes over those cells. And destroying cells is not a great idea. So your body has to fight back about this. And if your body does not fight back, you will die. It will take over all the cells of your body. So thank God that we have a defense mechanism against this. We have multiple defense mechanisms. This is a very serious thing. It basically attacks very important cells. These are all the cells that line all your blood vessels everywhere. This is not good. Gets in, it kills.
Yeah. Next slide, please. Yeah. So then also, as we know, when it replicates, the virus replicates, it can cause really bad symptoms when it's severe. So what I said earlier, when it binds to its receptor, one thing that the virus can do is that it can kind of further activate this system and increase the production of a hormone molecule called angiotensin 2. And what that does is that it can kind of increase blood pressure and by causing like vasoconstriction of your blood vessels as well as the cardiac muscle cells. And if this continues on for long periods of time, it can cause things like vascular dysfunction as well as cause your heart to enlarge. And also the virus can further activate your immune cells, and that can recruit very pro-inflammatory macrophages. And in very severe cases, it can lead to something called a cytokine storm. And when that happens, you would get like hyperactivation of your immune system and experience way more severe inflammation. And in addition to that, you can also very commonly experience a lack of oxygen or hypoxia. And what that does is that it causes increased metabolic demands in your cells. So your body has to work harder and also spend a lot more energy trying to fight the virus. So of course, all these things are things that happen with really severe COVID-19, but for patients who have congestive heart failure, there's some specific factors that contribute to all of these symptoms.
This is very interesting. If you go back a slide, so the virus infects your cells. You told us about the AT receptors, and then your body reacts to it. And in some circumstances, you can get something called a cytokine storm. You have an overreaction. And so what happens, there's collateral damage. So your body mounts immune system, but it's overactive, and then it starts to destroy its own cells. So the virus triggers an attack on your cells in your body and its defense mechanism. Sometimes it can overact and become part of the problem versus part of the solution. So that's when, for instance, things like steroids can be helpful in some circumstances, some medication. So to me is that we have all these drugs now that we have to fight viruses, but the best defense is still the vaccine and social distancing and avoiding. So I'm going to spend the best way to treat a disease is to prevent it from happening in the first place. And vaccines have a long track record of this and avoiding sick people exposures. In the past we quarantined people and things of that nature. And so if you think you may have COVID, you need to isolate yourself. And is it 5 days or 10 days? Or people have different thoughts about this. You certainly you spread virus a lot before you're symptomatic for a couple of days beforehand. So these are all things to be considered in your repertoire of things. And it's really a truly an amazing sets of information that you're sharing with us. And thank you for sharing that.
Yeah, for sure. So to take a look at some of those factors that make heart failure patients more susceptible to severe COVID, first, as we know, having heart failure can really reduce someone's ability to respond to those external threats we were mentioning, like infection and inflammation. So as we saw earlier, we saw that in heart failure, it can over time cause fluid buildup in your heart and lower pumping efficiency. And typically you can observe things like an enlarged heart, as well as weaker heart muscle inflammation and overall lower functional capacity. So all of these kind of pre-existing conditions, they already mean that the heart failure patient, they've kind of deviated from a healthy heart. So it makes sense that they have increased risks from that additional inflammation and vasoconstriction and stress that can be caused by COVID-19. And next slide, please. Yeah, and in addition to that, heart failure patients are really likely to be experiencing frailty. And basically that's characterized by things like having impaired exercise capacity, as well as limited mobility and having greater dependency on other people. And also you can have worse functioning of the cardiopulmonary system. So your lungs might be weaker as well from like some fluid buildup over time. And this frailty, similar to the last slide, it just lowers the ability to respond well and normally to those external infections, and that can also really cause the patient to experience more severe symptoms. Okay, thanks. Yeah, so in addition to this, also heart failure patients tend to experience a lot of comorbidities that, as you may know, which include like obesity or diabetes and hypertension, as mentioned before. And those conditions by themselves already impose greater risks. So you can imagine that when they're combined with heart failure, there's a way worse effect. So first for diabetes, it's been found that having insulin resistance that often contributes to having increased baseline inflammation in the body. And that's because it's kind of connected to a higher production of this molecule called MCP1, and that's pro-inflammatory. So having that is obviously dangerous for COVID infection. And in people with obesity, they typically have an increased body mass index, and that can also mean they have a greater proportion of adipose or fat cells to immune cells. And it's also been found they usually have weaker T cells, which are really necessary to fight off like foreign antigens and for the immune response. So all of these together can kind of lead to decreased immune protection in that individual. And also with hypertension and diabetes overall, there's kind of just overall a greater likelihood of having problems with like circulation and blood dynamics. So that can definitely compromise the patient's reactions. Yeah, and lastly, for comorbidities, one relation for patient, like common relation for heart failure patients is that they might have thrombocytopenia, and that's when they have a low platelet count. And since platelets are really crucial for blood clotting, one thing they found in COVID-19 is that it tends to kind of destroy or restrict platelets as well. So if you already have lower platelets in the first place with COVID-19, you might experience very abnormal blood clotting and increased risks of bleeding. So yeah, any of these comorbidities will really increase the likelihood of experiencing severe COVID.
So this is kind of interesting. If you look at this, that one of the things that we learned very quickly, the more overweight. So first of all, you need a good immune system. And so we know that young babies, pregnant women, people on cancer, immunosuppressants, rheumatoid arthritis patients have a weak immune system. We also know starting is that your best immune system is, your teenage years, 20s and 30s. As you age, your immune system gets worse. You all heard is that after 20, everything's downhill. Well, it's not quite that bad. Is after 20 or 30, you start to lose a lot of things and you start to lose function. And basically your immune system at the age of 50 takes a big hit, 60 even a bigger hit. So the best way, first of all, to boost your immune system, people say, well, I'm going to take my vitamin D, I'm going to take my vitamins and things of that nature. And, the data on vitamin D and things of that nature isn't very persuasive. But what really is really persuasive is how much you weigh. And so the best body mass index for many things, including COVID, is somewhere between 20 and 25. Once your body mass index is over 24, because you mentioned things of inflammation, overweight is an inflammatory process. So I spent a lot of time working hard to get my immune system better by losing weight. So think about if you really want to fight anything or prevent aging, from arthritis to Alzheimer's disease, hypertension, diabetes, is weight. So you mentioned that, by being overweight, your immune system doesn't work as well, from T cell function to your immune response. We know that, diabetes is just a bad disease to have. It's just a marker of, losing 10 to 15 years of life. And we know that COVID damages your pancreas, and you have acceleration of diabetes. We mentioned things like high blood pressure, then you your platelet count, and that's how COVID can actually damage blood vessels and cause blood clots. So I think you painted a very good story, is that, and what we don't know is that once you have COVID and you recovered, is this going to be a permanent recovery, or have you injured yourself? And what worries me is I remember that movie called Concussion, where all these athletes were well-fit individuals that developed, Alzheimer's disease and brain damage later in life. And we still won't know is that if you get COVID now when you're very young, is that going to shorten your life later? Don't know that. And so we're taking a chance with that. And so do things now to protect yourself. There's nothing good about getting COVID. And, people say, I will let my immune system work. Fine. I'm going to try to enhance my immune system. And you can do that. You mentioned things like just weight reduction, regular exercise, eating well can make a difference. the vitamin story is not very persuasive. And some people say, people have a low vitamin D level have higher mortality, but it's not clear that boosting vitamin D with supplements makes a difference or not. So that's actually something to consider. So we're learning, and the disease has changed already. Will change again. And I learned so much about our immune system over the last 2 to 3 years, and so it's been a great learning experience, but it's not one that I want to learn too much more about, and there's still more to come. So keep sharing, keep telling us more.
Yeah, that's very interesting. Yeah, definitely a lot of ways COVID can affect us like long term. And another kind of phenomenon in heart failure patients that we see is that they may have norepinephrine dysfunction. So norepinephrine, it's a neurotransmitter with a lot of effects and in the sympathetic system, but it can also usually regulate the production of our body's inflammatory cytokines and monocytes. And one thing that they found in heart failure patients is that they might have dysfunction of norepinephrine. So that would mean that it could disrupt that proper regulation. And as a result of that, what can happen is that the heart failure patients, basically, they might be more prone to excessive inflammation because they could produce more inflammatory molecules and less anti-inflammatory molecules than healthy subjects. And the importance of that is that as we said, in heart failure, in COVID-19, you will have an overall increased metabolic demand. And usually to compensate for that, you would need more like input to maintain that cardiac performance and output, but this isn't possible if you already have weakened hearts in heart failure patients. So yeah, this could also contribute to them feeling worse symptoms overall. Yeah, and lastly, as we kept on saying, the SARS-CoV-2 virus, it acts through the AT1 or ACE2 receptors to infect the cells. So naturally, this would mean that if there were more ACE2 receptors overall, there would also be more possible routes for the virus to kind of infect the cells and exert its effects. So one interesting thing that researchers found when they were examining ACE2 expression in the cardiac muscle cells of patients with heart failure, it was that heart failure patients express 3 times more of these ACE2 receptors than people with healthy hearts. Yeah, so this is really interesting because although it's kind of understudied as of now, it could also help explain why those patients are way more prone to being infected with and experiencing severe COVID-19.
Yeah, so the next topic we'll be covering is, can COVID-19 damage the heart and lead to heart failure? So starting off with how COVID-19 can damage the heart in patients. So COVID-19 has been shown to damage the heart because patients can develop cardiac injuries, which can increase the risk of future cardiac complications. So in the next couple of slides, I'll be referring to severe COVID-19 cases a lot. And what I mean by that is hospitalizations where the patient is typically experiencing some pneumonia-like symptoms. So in one study of COVID-19 related deaths, it was demonstrated that although the primary cause of death in patients who contracted severe COVID-19 cases was respiratory failure, the next leading cause was their cardiac dysfunction. So in COVID-19 hospitalizations, a lot of studies found that there were elevated troponin 1 levels, especially in patients who were of older age or if they had a more severe case. And what these elevated troponin 1 levels indicate is that the patient had an acute cardiac injury. When you contract a COVID-19 infection, as Junie was mentioning, there is also a large systemic inflammatory response and something called the cytokine storm. So the cytokine is a small protein that is secreted from immune cells in the body. But what a cytokine storm is a little bit different because it means that the body is releasing way too many cytokines into the blood too quickly. And this will create a lot of hyperinflammation, which can progress the development of a cardiac injury and really cause damage to the heart. So myocardial infarction and COVID-19. So there is a correlation between COVID-19 cases and acute coronary syndromes, which can be any number of conditions that result in the sudden reduced blood flow to the heart. So COVID-19, as we just mentioned, can damage the heart and lead to an MI, which is a heart attack. And this can also act as a predictor of in-hospital mortality because a heart attack will put a lot of strain on the patient's overall wellness, especially if they're in the hospital because of their COVID-19 infection, and that can trigger a rapid decline in their health. Some data from a hospital in New York during one of the earlier waves of COVID demonstrated the link between COVID-19 patients and acute MIs, as several patients showed ST segment elevation on their ECG and were later diagnosed with MI. So in this image here, you can see the ST segment elevation on the ECG. And what that is when this is elevated, it basically means that the patient has an ST-MI, which is an ST elevation myocardial infarction due to heart damage or artery blockage. And similar data was actually found in Italy, where a study with 28 patients showed that 79% of COVID-19 hospitalizations were experiencing chest pain, and out of those 79%, 86% were experiencing an MI. So COVID-19 definitely does damage to the heart. It can cause acute coronary syndrome, and it can cause you to have a heart attack, which can increase the rate of decline if you're already hospitalized.
So let's pause for a second. So we're saying ST elevation just means, troponin means heart damage. ST elevation means a heart attack. You can see you have plaque. COVID causes more blood clots, more damage. So this is actually, we know that if, for instance, if you have shingle infection, you have more heart attacks. If you have influenza, more heart attacks. You get pneumococcal pneumonia, more heart attacks. You get COVID, more heart attacks. These all damage blood vessels. So, we lower blood pressure, we don't smoke, we exercise. We treat blood pressure to prevent damage to the heart. Infections from influenza, pneumococcal pneumonia, the common pneumonia, COVID, damage the heart. So you can see that, these are all, you can either try to make the endothelial cell, that lining of the blood vessel, healthier or more damaged. And you can see, so it reminds us that there's so many ways to protect your vessels, and one is not to have infections in general. Go ahead, tell us more.
Yeah, for sure. So moving on, we're going to talk a little bit about how severe COVID-19 cases can lead to heart failure. So COVID-19 can definitely exacerbate current heart failure, but many people are unaware of the implication that COVID-19 infections can have in previously healthy individuals. So developing heart failure from COVID-19 infection does happen. And depending on the hospital, the new onset of heart failure was observed in even up to a third of ICU patients. So that's quite a big chunk who may have been previously healthy or may have had a couple of comorbidities, but they were not in the hospital due to heart failure, and that's something they actually developed after their COVID-19 infection. As I mentioned earlier, COVID-19 infections do result in the release of those pro-inflammatory cytokines, which can lead to that severe inflammatory storm. And that can definitely exaggerate any initial injury. And when that's paired with an increased metabolic demand, it can definitely lead to new onset heart failure or the acute decompensation of current chronic heart failure. So cardiac injury weakens the heart, and this can potentially lead as well to the weakened ability for the heart to pump blood around the body, which is just another way that COVID-19 infection can lead to heart failure, even if you were previously healthy. So the long-term effects of COVID. So many of us know about some of the short-term side effects of COVID, but there are also plenty of patients who have experienced long-term effects of COVID as well. So beyond the first days of infection, COVID-19 patients exhibited increased risk and even up to the 12-month burden of incident cardiovascular disease. So this can include cerebrovascular disease, dysrhythmias, inflammatory heart disease, ischemic heart diseases, and heart failure, and a plethora of other cardiac disorders. So the long-term effects, although they're definitely amplified by other comorbidities such as obesity, hypertension, and diabetes, they were also evident in patients who had not experienced prior cardiovascular complications, which is one of the reasons why it is so important to be keeping yourself safe. The long-term effects of COVID do not just relate to the heart. So there were also cases of long-term effects that were related to the nervous system in the cases of stroke or encephalitis, which is the inflammation of the brain. Having this encephalitis or any sort of systemic inflammation can also just lead to really damaging long-term neurological consequences, which can go anywhere from mild cognitive impairments to other neurodegenerative diseases like dementia. And in patients who already had a diagnosis of Alzheimer's or other forms of dementia, it was seen that after their COVID-19 infection, the rate of cognitive decline and brain changes really increased. So it's definitely something to look out for. And the more comorbidities you have, you definitely want to avoid getting COVID-19 as much as possible, because there are a lot of long-term effects, which leads us right into the next part about vaccines.
let's talk about vaccination. And this has been a somewhat controversial topic of discussion during this pandemic. Next slide, please. So although vaccination against COVID-19 does not protect you from infection, it greatly reduces your risk of severe infection and hospitalization. Now, that's a very important note to get down because there's often the misconception that they will completely prevent, and some people will try to delegitimize the vaccines because they don't prevent you from getting COVID, but it's important to note it greatly reduces the risk of severe infection and adverse effects. So for most vaccinated individuals, this could feel more like a mild cold with fewer adverse and long-term effects, as opposed to a coronavirus infection in unvaccinated individuals that might be more serious and require hospitalization. Next slide, please. In addition, kind of building on what we just mentioned, unvaccinated people are more susceptible to what we call long COVID. And these symptoms can last weeks, months, or even years, and usually becomes apparent a few weeks following COVID-19 infection. Common symptoms of long COVID include fever, fatigue, shortness of breath, heart palpitations, coughing, chest pain, lightheadedness, brain fog, headaches, sleep disturbances, feelings of pins and needles, altered taste and smell, depression, anxiety, stomach pain, diarrhea, changes in menstrual cycle, rashes, and muscle and joint pain. So you see there's a wide range of symptoms that are not completely related to one specific aspect of health, but rather kind of all around the body and different systems of the body. And these symptoms may often be unexplainable and difficult to manage. Next slide, please. And another thing that's mentioned a lot, especially in the news, that although the vaccine is safe and we do really recommend it to reduce the risk of severe infection and hospitalization due to COVID-19 infection, there are rare cases of adverse effects that some people have experienced. These may include myocarditis or pericarditis, that being inflammation of the heart muscle in the case of myocarditis, or inflammation of the outer lining of the heart in terms of pericarditis. And this was most commonly seen with the Moderna vaccine in young males, although it's also been noted in some Pfizer vaccination in young males, but it's for the most part Moderna. In addition, there's thrombosis and thrombocytopenia. Thrombocytopenia we touched on earlier today, but also involving abnormal blood clotting in terms of thrombosis, which results in clotting and the blockage of certain arteries, and low platelet count, which results in abnormal blood clotting. And this has been mostly observed with the Johnson & Johnson vaccine. Another area of adverse effects is the Guillain-Barré syndrome. I know I didn't pronounce that correctly, but that's mainly marked by muscle weakness and even paralysis that occurs due to nerve cell damage by the immune cells. And it's been most commonly observed with the Johnson & Johnson vaccine as well. And lastly, anaphylaxis is a severe allergic reaction. Now, this is an adverse reaction that may occur with any vaccine, but it is also very rare in this case, as goes for the rest of these effects, even though they have been noted in a lot of people who have taken the vaccines.
So this is actually very interesting. If you go back a little bit over here, is that the virus is, again, it invades your cell, takes over and destroys your body, fights back. And basically, they're always off-target lesions. They either can be from your body or it could be from the vaccine. But the magnitude of protection, and so the initial vaccines were 90% effective, decreasing hospitalization or deaths from COVID. Now, the initial hope that we were going to get to herd immunity, that this would be over, and I do think that being vaccinated helps decreasing spread. The best series came from basically nurses' studies and doctors' studies where they actually vaccinated thousands of healthcare providers, and they looked at their families. And within a month of being vaccinated, there was a dramatic reduction in family members and friends getting COVID. So that's the first evidence about that. But we also learned is that against various disease, what they do the best. So so I think that's important. And all these vaccines were designed to go with something called the spike protein, and they were basically vaccines were given, and so your immune system would fight the response through blood, and sending you're attacking immune cells to the blood, usually to the lungs, for instance. Now, the virus gains that entrance predominantly through the nose. So the next generation of vaccines that are being developed right now is you're going to inhale them, and you have local responses. So you want the defense where the virus enters. So we'll see what that does. And there's actually now is that vaccines are going to go after different parts of the virus. And so we have a lot to learn. So we really hit a home run initially with the vaccines. The development was very rapid because usually when you do vaccine trials, you do different stages. What the governments did, they spent billions of dollars letting all stages go of vaccinations and research simultaneously, not one after the other. So a lot of research was done, but was done very rapidly. Now, research obviously is slowing down because there's other issues we have to deal with in society too as well. I get it. But it's truly remarkable how effective they were, and how the disease is actually spread as well. At one time we were worried about, touching somebody with COVID. Now we realize that most of it is through inhalation. Other small or large droplets, the virus can travel greater distances. So it is truly remarkable. Yes, you can get Guillain-Barré syndrome, which is pretty unusual. Anaphylaxis, that can be from any reaction. And the thrombosis that first came was really with the AstraZeneca vaccine, where was a platelet-induced antibody that was discovered, and the mechanism as well learned in that, causing thrombosis. Now, myocarditis, inflammation by the vaccine, you're a lot more likely to get myocarditis inflammation from COVID than from the vaccine. Yes, you can get it from the vaccine, but you're much more likely to get it from COVID. And I think you showed that very well. So, vaccines have a long track record. Unfortunately, there's polio that's coming back in some areas, and now we're learning more. So keep telling us more. Thank you for sharing that.
For sure. And it's very interesting, like you mentioned, about vaccines and kind of the next steps in terms of research, and how more research now is, although it's slowing down, it's still being done, and it will only continue to progress. And that's why I really do recommend to check out this video about vaccines, supporting your heart health, just to describe more for whoever's interested to learn more about vaccines and why they're important, why we take them, and how they helped us in this pandemic and others as well.
You remind me of some work I did a little while ago, and but this is actually kind of interesting. So what I've learned is that, as we talked about, and take a look at this video, it's not that long, but it's actually kind of important, is that, again, getting the common cold influenza increases your risk of having a heart attack or stroke. And what happened was that just getting the flu shot, they did this in 3 consecutive flu seasons, and it get people came into the hospital with a heart attack or went for an angioplasty, and it showed that getting the flu shot decreased the chance of you getting very sick from the flu. Not necessarily getting the flu, you probably decreased the amount of flu, but it decreased mortality, decreased chance of a heart attack by almost half. So so basically I get my flu shot every year, and one of the reasons is to prevent a heart attack. Interesting, prevent a stroke. Who would have thought getting the flu shot can actually prevent a heart attack? It can. Same thing is that I got my shingles shot this year, and getting shingles increases your risk of getting a heart attack. And over the age of 50, your immune system starts to waver. So those who make it above the age of 50, you have a 1 in 3 chance that you will get shingles, reactivation of the chickenpox virus in your lifetime. And it can be, for some people, very debilitating. So I got my shingles shot, my Shingrix 2 shots. And funny was that after I got my shot, I forgot I got it. And I felt sick for a couple of days afterwards. Oh no, I got COVID. No, I didn't get COVID. I just had a reaction to, the aches and pains of having a shingles shot. And that was actually one of the most severe reactions, not a severe reaction. And so, my tetanus is up to date, my hepatitis is up to date. And I got something called Prevnar 13. Prevnar 13 is that all young kids now get a series of 3 injections when they're young in life to prevent ear infection, otitis media. When we grew up, I had my tonsils taken out, and the reason they got my tonsils taken out because I had pneumococcal pneumonia in my nose, and that gave me give me ear infections. And if I got pneumococcal vaccination back then, I wouldn't have had my tonsils taken out, or having people got tubes put in their otitis media. And so that no longer exists anymore because of pneumococcal or Prevnar 13 vaccinations. So, so something to think about. So you can think is that, a good doctor makes a good diagnosis, a better doctor prevents people from being sick, and vaccinations have a true track record on this. And so when people say, I'm going to have a natural immunity, most of the time you get better immunity with vaccinations. I don't want to get sick. I don't want to get my cells destroyed. So I'm sure you don't want that as well. So take a look at that video. It's a really very interesting observation there. Thank you. Tell us more.
Right, and as we're kind of nearing towards our main COVID and congestive heart failure part of our webinar, we also want to recommend very important webinars and videos. The one on the left is a video, the one on the right is a webinar that we've done with this club, just for important information regarding predicting, tracking heart failure, and interpreting results of at-home and diagnostic tests. And one thing I recommend from both of these is to check out the KCCQ section, which is a very useful self-administered test to evaluate your heart failure status. And yeah, they're very useful tests. It's good at home, allows you to interpret your own results and track and manage your condition, especially in this world where it's so unpredictable and you have so many factors like COVID-19 that could influence your condition as well.
So I think the leading cause of mortality for many of us will be congestive heart failure. So you can actually learn how to predict it, and you can actually measure it called the Kansas City Questionnaire. It's a system, it's a scoring system from 0 to 100. I think we all got used to our grades between 0 and 100. So 80% is 80 what it is, 60 what it is. So you can actually calculate, look at yours. So I encourage everybody to do that once or twice a year, looking how you prevent heart failure. So I think you know that already, is that don't get older, but if you do get older, age well. Make sure your blood pressure is controlled, make sure your weight's controlled, make sure that you have being healthy, having a good attitude. I will say this is that quality relationships are very important, and not getting sick and making people sick or preventing illness and making sick. Looking about heart failure, there's a whole series of videos on heart failure, and please take a look at that.
Yep, and finally, what we recommend is to watch our previous webinar about BNP and pro-BNP, both of which are chemicals in your body that are in circulation associated with heart failure and are kind of being researched or still being thought of as indicators for heart failure. The research is still undergoing, but it's important to note that as part of an Ontario pilot program, there are pro-BNP tests that are available for free of charge until March 31st, 2023. So it's important to talk with your healthcare provider to see if that's something for you to help track, manage, or diagnose your heart failure as well.
So I think this is something really important. I applaud the government for allowing us to do this. BNP is brain natriuretic polypeptide. It's a hormone that was first discovered in the brain, but it's actually found in large concentrations in the heart. This is actually a natural hormone that responds to when the pressure inside the heart's getting elevated. Your body releases this hormone to help repair itself. And we can actually use it to see the status, how sick you are or not. So BNP, brain natriuretic polypeptide, should be probably renamed to heart pressure hormone. And pro-BNP is just a precursor to that hormone. So we actually measure them. That's the one that is recommended. So a value over about 125 of pro-BNP is, or 100 to 125 is considered to be elevated. And depending how high it is. And please take a look at that. And it changes in different conditions. As you get older, it goes up. As you gain weight, it actually goes down. And so we have to redefine that. As your kidneys don't work, it goes up. And something called atrial fibrillation, it goes up. So it needs a physician's interpretation. You have to look between acutely ill or chronically short of breaths, but I think it's a very valuable hormone to look at. And it's a marker for bad things to happen to you. And it's important to understand that. So it points to that the pressure inside the heart's elevated, that you probably have congestive heart failure. It goes up for other conditions too as well, but it's very, very useful test. So take the time to look at it and then decide whether or not we should measure that in your circumstance and discussion about that. So I'm grateful for the Ontario government to allow us to do that. And so we're spending a lot of time and effort getting that. And right now we're giving people 2 sheets of blood work right now. The reason we're doing that is that people have had difficulty accessing blood work. So, and we usually put repeat in 4 months for some blood work. And so most sheets for blood work are good for 6 months. Sometimes the lab lets it go for up to a year. And so we want people access to that. And we actually measure a pro-BNP on many people who are at risk for congestive heart failure. So it gives us some helpful clues to why you might be short of breath or you're going to be in trouble. And so take a look at that video and tell me what you think. Tell us more.
All right, well, that brings us to the end of this webinar. We really hope you learned, a thing or two here and there about COVID-19, how it might increase your susceptibility of either cardiovascular disease or in relation to heart failure, or how having heart failure may leave you more susceptible to increased risk of adverse reaction due to COVID-19. But yeah, that's the end of our webinar.
Should we show off our YouTube, how you can sort of access more, if you guys are interested, more videos on congestive heart failure, Dr. Curnew? Oh, I think you might be muted. Oh,
can you hear me? Can you
I
hear me
can hear
now?
you now. Yep.
Yeah, sorry, I was just muted. It's probably when I talk and no one listens to me, because most people actually remember about 10 to 20% of most doctors' visits. So if you can bring somebody that can have an extra set of ears, write down your questions and think about what's important, but come prepared. I was just saying during this webinar, I had a nice rich salad and antioxidant salad. I encourage people to spend time. I think a lot of people have sleeping problems at this stage in life, and the best way to cure your sleeping problem is look at one of our webinars for 5 to 15 minutes. It will put you to sleep. You'll learn something, and I guarantee you'll wake up more refreshed the next day. But spend the time to look at that. So I thank the team for presenting. One of the things is that we'll show you a couple of things, and I am technology silly, and I learned a lot from all these young people. So the best way to get better technology is to ask a young person. So I think Daniel and the team is going to take us a little tour on a few things. Show us a few things.
Yeah, so if you guys enjoyed this webinar and you want to check out we've highlighted a few important webinars and videos related to heart failure that we'd like you guys to check out. But if there's even more that you guys want to take a look at, and we highly encourage you guys to do so. If you go to our YouTube channel, so if you type in youtube.com and to get to our YouTube channel, you can just search Curnew in the top sort of search bar. And go to the first channel, that's us. To find more, webinars or videos, there's 2 ways you can sort of, or relating to heart failure, there's sort of 2 ways you can find them. You can either click on this magnifying glass here and type in just CHF and do a search. It sort of searches our YouTube page and it brings up all these different really, very helpful webinars on heart failure. We have like what is heart failure, treatment and management, different types of heart failure and sort of blood tests you can use, the importance of exercise in heart failure. And there's many videos, like, dozens and dozens of hours of content, useful content that, can help you sort of better understand what heart failure is.
So I'm just going to pause here for a
Yes.
second. Predicting heart failure is a very interesting one. The Kansas City questionnaire. One is using science as much as you can. There's something called Emperor Preserved. We were involved in some of the trials in heart failure to learn that better. If you go down, one more thing is what's in the blood. This is actually a very important webinar. I encourage everybody at some point in time to look at this. Yes, it's long, but you now have access to your information, and part of it is we'll explain that video as well. prescription renewals, I'm hearing too many times where people are saying is that the pharmacist will contact you. Well, the gas station doesn't call you when you're out of gas. You avoid running out of gas. And right now, one of the leading causes of medical errors is getting medications wrong. So become an active participant in your medications. And so take a look at that. And um, you can see that people have atrial fibrillation. That can be a part of heart failure as well. Did you know if you have atrial fibrillation, you're 3 times more likely to have congestive heart failure? And there's some examples. There's so many things to look at. So you can see that just by typing CHF, you can get lots of information. And remember, what I do is I fast forward certain parts. I go back to other parts as well. I probably have seen all these videos multiple times, but you guys got to look at that too as well. You need it more than I do to be knowledgeable and things of that nature. We'll try to make it a little bit shorter, but it takes time to explain concepts, and so I like to take the opportunity to do that. Tell us more.
Yeah. If another way you can find a bunch of, heart failure or just very useful videos to check out. If you don't want to use the search function, we've also, organized a lot of our webinars and videos that we've done over the years into these playlists. So when you go to our channel, you'll start off at the home, but you can click the playlists tab, and you can see that there's a bunch of different playlists that have been sorted if you scroll down into sort of the short sort of weekly videos around 10 to 15 minutes, and then we have our live series or our webinars, and we've classified them into sort of groups. So we have the heart failure sort of webinars or short videos and webinars here. We have those by the exercise club or the medications club. So if you're really interested in high blood pressure, you can check out all these different videos that we have on high blood pressure here. So it's very, very nice and organized. And if you have a specific topic where that you're interested in, check out our playlists.
It's something I haven't used as much as I like. So you have the short one and the long one. And for instance, if you're interested in cooking, you can go to the cooking club. You can look at that. If you're interested in understanding science, your diabetes, understanding technology, if you want to know how to use some of these things better, take a look. So what we try to do, at least in these ones, is give you as much science as we possibly can. So take a peek and tell us what you think. And put some comments in there too as well, so we can just see how we can get better. So I know one of the comments is be shorter. That means I have to shut up more. But there's so much to share. I wish I can take my hard drive, put it into your hard drive, and you can just digest what I've learned for the last 50 years or so to make life easier. Because I honestly think is that I know a lot that can make you healthier. And I think I can sort out the nonsense from the facts, and I can tell you what we do know or don't know. And I feel so bad because outside my field, I know very little. I know an awful lot about very little, and I wish I can share that. And it's really frustrating to me when I see so many mistakes being made and so many people having so much misery and being uncomfortable. People say the golden years aren't golden. Yeah, no, they are golden if you know how to do that. Most of us will be lucky. We can probably spend a third of our life in our retirement ages. And I'm not sure if I remember when I'm going to retire, but as long as I can contribute and I see these young people taking over, it's a real pleasure and honor to serve and to help. So please take a peek and encourage other people. Put your comments as well. Any other thoughts about that, Daniel, or anybody else want to say about the this YouTube channel? Because it's just remarkable. I think this is the work of hundreds of people to get to this level, and it really is a group effort. And it's like anything you need your entourage to be healthier, to be friendly. And one of the important things is the longest trial of longevity shows that quality relationship is the number one predictor how long you're going to live. And I feel very fortunate to have worked with hundreds of people, students in my career, and to be involved with thousands of patients. And you all taught me a lot, and I hope I can serve you well, and I hope I can pass this information. So take a look. very proud of what this work has been done. Tell us about our webpage now.
Yeah, so we'll be talking a little bit more about this next week, but just sort of to give you guys sort of a sneak peek of, what our team has been working on. We've I know many of you probably have gone to drcurnew.com and have seen like an error kind of, and it's like what's going on? So we decided to launch a sort of newly improved website. So our new website, if you go into Google and type in at the top drcurnewhealth.com, this is what our new website will be. And we're going to go through a little bit more next week with our website lead, Stephanie. But guys, you guys should check it out. In the meantime, we have a bunch of different information on our YouTube channel, all the different series and videos that we have. We have information about our focus groups, and you can actually sign up for all the various different focus groups you're interested in. Weight loss, sugar club, losing 30 pounds in 30 weeks. It's all here, and it's all sort of accessible to sign up. And we have a bunch of different other information like stuff to bring, important things for your appointment. So, what reminders for things that you should prepare for when you have like a phone call with Dr. Curnew or when you're coming in to see him, as well as finally we have sort of a tab about, all the different medication information. So Dr. Curnew, you and Dr. Curnew have decided to start a ACE inhibitor. What are the different types of ACE inhibitors and what exactly is it, right? And we have some examples here. So give it a check out, and we'll be going in a little more depth, next week when Stephanie joins us.
So, to me, this is a marathon, and and we have some other ideas from a health bulletin board. We also have our Twitter, our Facebook, and we have so many different active groups in there. So please join us. Please share, and if you have any ideas, we'd be glad to try to implement that. And we actually have an app right now we're working on too as well. So there's so much to say, and I want to thank you all for allowing us to try to make you a little bit healthier and point out facts from fiction. Is that there's a huge meta-analysis of all the vitamin trials that unfortunately vitamins are a multi-billion-dollar industry that's gone right for the people selling it to you and wrong for the people who are taking them most of the time. So we're eating your fruits and vegetables. Mother Nature figured out the magic formula, and we as humans haven't figured out how to do that well when it comes to that. So eating, exercising, quality relationships, working at trying to learn new things. So take a look and give us some feedback and what else you want us to do as well. I want to thank the entire team, and I'll give Daniel the last word. What's your thoughts on what you learned tonight, Daniel?
I think for me at least, I'm going to go back to this slide that I think really stood out to me the most. Because one thing that you always say, Dr. Curnew, is, and these are obviously numbers from the beginning of the pandemic, and obviously the virus has changed over the many years, and it's basically quite different nowadays. But these numbers really jump out to me at least in terms of, having just high blood pressure increases your rate of, dying from COVID by nearly threefold. So it's like you said sometimes, or like you always tell me, many of us we're gonna get COVID, all of us really, many times over, right? So it's in our best interest to uh, you know set up our cards properly. So that's eating healthy, losing weight, keeping up proper physical activity, and just we need to stack the deck in our favor essentially. And I think
Yeah,
that's really what I take away from all of this, because it's all these comorbidities, they just make things worse, right?
yeah, it's kind of interesting. The initial data sets were a reduction in chance of being hospitalized or dying from COVID, 9-0. That's pretty remarkable. And first of all, is that people are afraid of being vaccinated. To me, the real heroes in the vaccine story are the hundreds of thousands of people who volunteered for the vaccine trials. These were people like, sorry, I want to cry when I hear this. They gave their arms for you and me. They volunteered, and they didn't know what they were getting, and they saved a lot of lives. And is that truly remarkable. So I spent the last couple of years of learning a lot about vaccines. We still have a lot to learn. The disease has changed, but what I learned is that the story of vaccines is, a well over a 50-year story, and it didn't happen by accident. It took a lot of research to get there. The cars of today are based on the cars of yesterday. The vaccines of today are based on what happened in the past. So I don't think there's a conspiracy story to show us how bad COVID can be. I've had the honor to serve in a COVID ward, and it can be a devastating disease. So I hope to never have to go back to such a place as a physician or as a patient. And so let's think about how we can work together in this story. This is really compelling data. But you're right, is that we have a lot to learn, and the final chapter is not written. So as of today, what I'm doing personally is that I'm getting a vaccination every 6 months with the vaccines that will be released to us. That will certainly change. And reason I'm getting vaccinated is that I do have an immune system. I did the boosting that I could from regular exercising, losing weight, and exercising. But if I think someone's sick, please don't come to my office, and I won't come to your home. Wear your mask properly when in high risk situations. If needed, wear an N95 mask. Use good judgment. Keep your guard up, and be healthy. And I'm touch wood, so far I've been saved. I don't know what the future holds, and so tomorrow, anybody wants to join us, we're going to be at Linden Park at 3 o'clock. I'm playing some tennis outside. I'm playing squash at 6:30 tomorrow morning, and then I'm picked up my new hobby of plane gliding. So what I learned about plane gliding, I'm a lousy pilot, so don't fly with me at this stage. But I'm really grateful for. I've had over 25 flights, and most people learn quicker. I'm having trouble learning how to fly this plane glider, but I'm just going to get better and keep working at it. And I spent the last 50 years of trying to understand healthcare and deliver it to yourself. So allow me to serve you and take what I have to say seriously. I have your best interest at heart, and what I don't know, I'll tell you. When I do know, I'll tell you that too as well. And there's so much to learn. And thank you so much.